ReDS, or Remote Dielectric Sensing, is the unique proprietary system developed by Sensible Medical for the detection of lung fluid volume. ReDS technology is a miniature medical radar system whose design is based on the see-through wall defense technology developed by the Israel Defense Forces. Originally, it was developed to see through structured walls so they could know who was inside a room or detect survivors in rubble. Sensible has transformed the technology and applied it to medical applications so that it can see through the walls of the thorax and detect the amount of fluid in the lungs. There are several applications for this, including but not limited to the management of lung fluid in patients with heart failure. When a patient has chronic heart failure, their heart does not pump blood as well as it should due to either deficiencies in the heart muscle and its valves, or an issue with the electric signaling that causes the heart to beat. Both systolic and diastolic failure can cause fluid to back up from the heart into the lungs. By the time a patient's symptoms are so severe that they experience noticeable weight gain and difficulty breathing, it can be too late to prevent an acute event. ReDS technology is revolutionary in that it allows for direct, absolute monitoring of the fluid level in the lung and can detect minute changes in volume status to help identify potential issues sooner and keep patients out of the hospital. ReDS miniature radio frequency-based system is transmitted from between two specially designed sensors. The RF wave is transmitted from the sensor on the patient's back through the thorax and the right lung and is received by the sensor on the patient's chest. In the frequency range that is used by ReDS, there is a very high sensitivity to fluid content, much more than with X-rays and ultrasound, while dry tissues, such as fat and bone and air, are transparent. The wave speed and power are greatly affected by the amount of fluid in the tissue it passes through. It will travel slower and become weaker the more fluid. By measuring the travel time and power levels at the receiving sensor, ReDS can directly and accurately measure the fluid content in the tissue. The device pulses a high number of highly focused readings over a 90-second period and takes an average. The output reading is a fluid content of the 3-inch wide cylinder-like cross-section that exists in the area between the two sensors covering the upper, middle, and lower lobes of the right lung. Because ReDS relies on this unique RF fluid volume detection technology, it is directly correlated to CT, the most accurate available method for measuring lung fluid. What truly sets ReDS apart is that it is the only way to obtain an absolute fluid measurement in the lung. In as little as 90 seconds, a provider can obtain a non-invasive and accurate, actionable level of fluid buildup in a patient with heart failure. The resulting aid in decision-making has helped providers dramatically reduce heart failure readmission rates at facilities across the United States. ReDS technology can add value across the continuum of care, from the heart failure floor to the outpatient clinic, the emergency department to skilled nursing discharge facility. Wherever it can obtain critical fluid data with accuracy currently unavailable without an implantable device.